Visceral fat is poison. You are not designed to have visceral fat. And in your design, it was the intermittent fasting that actually gets rid of visceral fat. Visceral fat is pathological. So basically, we should think of fat as 3 locations of fat. The first one is the regular fat, the fat that people have under their butt, for example, or in their thighs or under their arms, and that's just subcutaneous fat. And usually that type of fat is not very inflammatory. So if I did a biopsy, I'll find some fat cells in it, but there's not much inflammation. Then the second type of fat is the visceral fat. This is the fat around your internal organs. I call this ectopic fat. This fat is in your liver as well. And there's fat in your omentum and around your pancreas, and the belly protrudes outwardly. Ectopic fat is also the fat around your coronary arteries. Now, there's the connection with me also. So this ectopic fat, the very word ectopic means it shouldn't be there in the first place. So then you got to ask yourself, let's reverse engineer this. What made that fat go there in the first place? How come people never had that before? Maybe they were just obese, but they were not metabolically sick. That's the problem. When you are metabolically sick, you're going to have visceral fat. So visceral fat equates to metabolic illness. So again, keep reverse engineering. So now you have the phenotype. The phenotype means the finding of visceral fat. So you say, what made that happen? Metabolic disease. Then you say, what caused the metabolic disease? And that's when you come to high insulin levels, high glucose levels, toxicity, lifestyle, circadian pattern disorders, even metabolic endotoxemia, which means leaky gut. Any inflammation in the body is going to give you a metabolic derangement. The metabolic derangement is going to give you visceral fat. Visceral fat is inflammatory. If I biopsied it, it's full of white cells, macrophages. If I did a chemical analysis on it, it's full of interleukin-6, tumor necrosis factor, and other cytokines that are being produced because that fat is inflammatory. It's not normal fat. It's not normal to have that. So my interest in visceral fat is because I know that coronary artery disease is an inflammatory condition. How? Because if you analyze the plaque, it's inflammatory. There's T cells in it, there's B cells in it, there's macrophages in the plaque. So all this comes down to inflammation and the molecules that drive inflammation. So that's where I got very, very interested in visceral fat in the first place. And that's why we now, on every cardiac patient, we look to see how much visceral fat you have. So recently, we put in a DEXA scan machine in my office to specifically look at the amount of visceral fat that you have. And we now can quantitate it on the DEXA scan and follow it longitudinally with the interventions that we'll talk about, because I do want to get rid of visceral fat.